These politicians share our certainty that a solution lies in evidence-based, nationally accepted professional standards regarding patient assignments.
Legislation puts the decision at the bedside, not at the Capitol. Study after study shows proper staffing lowers healthcare costs. Other states that have implemented and or studied staffing standards reports the probability of death drops by double digits. Nurses working at the bedside tell me that they're at risk, and I believe them, and that's part of the story. The legislation means nurses will be able to affect staffing decisions, while for years they haven't been able to have, I think, as much of a voice as they wanted to have in this particular issue. My involvement in this is really to make sure we have great patient care, that we work as hard as we can to make sure those at the bedside are being protected and are able to do patient care, and at the same time making sure that hospitals are able to continue to function and be able to go about their business in helping people get well.
As the study after study will show, or has shown, this actually leads to a decrease in healthcare costs, and in states that have instituted this change, we've actually seen double-digit decreases in the probability of death.
Patients are suffering and families are grieving, and they are being exposed to too much risk in acute care hospitals today. It is all so unnecessary. Beyond the closed doors, behind the curtains, below the shining brass awards for safety, nurses witness too much suffering and too many errors. We catch way too many near misses because we are stretched dangerously thin. It is simple, it is comprehensive, it will reduce grief, suffering, and cost. Every patient deserves a standard of care.
We catch our breath every time that we have a near miss, or we give a late medication, or a discharge that we have to hurry up and do, and we can't really give the proper instruction for a mom with a child they're taking home. Our frustration mounts when we warn our managers that in our professional judgment, our patients are at risk as a result of not enough time to provide adequate care for the amount of patients at the level of acuity that we are assigned to. Sadly, our notice is sometimes met with no response at all, or more often, a hollow, make do with what you have.
They've researched. They know how much time it takes to care for children, for adults that need care. Let's use that research. Let's work together. Let's have a law that can mandate that care, because we need to have professional nurses doing a professional job every shift.